Welcome, everyone. Thank you for joining us today. I'm Teresa Marantat, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today, we are reporting an increase of 36 new cases of COVID-19 in Windsor and Essex County. 15 are close contacts of confirmed cases, 18 are community acquired, 1 is travel related to the U.S., and 2 cases are still being investigated. We have had 16,255 cases since the beginning of the pandemic. 348 people are active at this time, with 167 of our active cases being a variant of concern. To date, 1,500 preliminary or confirmed variants have been identified in Windsor-Essex County, with 92% of these cases being a UK variant. 3 cases have the South African variant and 4 the Brazilian variant. 23 people are currently in the hospital and 1 person is in ICU. Our community has lost 422 people to COVID. There are currently 9 active outbreaks in Windsor and Essex County, 8 workplaces, and 1 community. Now for our vaccine update. 229,155 doses of a COVID vaccine have been administered to Windsor-Essex County residents. 213,155 people have received at least 1 dose. Overall, 62.6% of adults 18 years of age and older in Windsor-Essex have received at least 1 dose of a COVID vaccine. People 18 years of age and older are now able to book their vaccine appointment at one of our mass vaccination sites. Please book your appointment at wevax.ca or through the call center at 226-773-2200. People are also able to receive their first vaccine at a participating pharmacy or primary care provider. Please visit our website at wechu.org for more information about COVID, testing, and vaccinations. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. As we continue to see our cases fluctuating from 70 to 16 to today 30 or so, it is really important that people need to get the message that while our vaccination rates are going up, we still need to take all the precautions. We are seeing, and our EPI is working on a report right now to dive a little bit deeper into those who are vaccinated and if they are coming back with a positive case. So there are some indication that some individuals who have received the vaccine, even in their first 14 days, contracted the disease. Obviously, at that time, their immunity is not there. But there are some individuals as well who have contracted COVID after 14 days of receiving their first dose of vaccine. Even though that number is low compared to the amount of vaccine that we have been given out, but I just want to make sure that people understand that getting the vaccine doesn't mean that you will not contract the disease right away. And it just reduces your chances of contracting and reduces the likelihood and severity of the disease and hospitalization. So regardless whether we are talking about a vaccine effectiveness of 82%, 92%, there is that the remaining risk that continues to be there. So that's why it's important that we follow the public health measures. We reduce the likelihood of exposure. We reduce the likelihood of coming in contact with other people at such a closer distance that puts you at a risk, because that's not what we want at this time when our rates are going down, where case rates are going down and our vaccine uptake is going up. So there will be, if there is a significant number of virus that continues to circulate in our community, we will be at a risk. We need to reduce that number of circulating virus in the community up to a level where we don't have to worry about these public health measures. So until that happens, please follow those public health measures. The second topic I want to touch on is the issue of cross-border travel for vaccine. And as we know that there has been some clarification issued by the Public Health Agency of Canada late last night about the quarantine requirement, and according to the news report, I haven't received the formal notification yet, but according to the news report, these individuals, if they cross the border, they'll have to quarantine. And recognizing that we are still in a pandemic, there are still some border restrictions and controls in place. So from a public health perspective, our position hasn't changed. We continue to advocate to getting the vaccine in Windsor-Essex for our people. Even though we know that there are vaccine supply available, we are working through all our channels, all our federal government partners, provincial government partners to bring the vaccine to Windsor-Essex to give it out here, rather than people crossing the border when the borders are closed and putting everyone at a different situation. So stay tuned for more details. We will share more details when all of these things are sorted out. It's not an easy solution to get the vaccine or move it, bring it across the border, but we are working on that plan, and we are working on that strategy to do that in a proper way to ensure that if they have excess vaccine, can we get those extra vaccines? So please stay tuned for further details. Until then, our public health position stays the same, that we are not supporting any kind of cross-border travel unless it's not essential. Last point that I want to touch on is regarding the second doses for AstraZeneca. We have been in talk with the ministry to look at how we will give out the second doses of AstraZeneca. So as I mentioned earlier, there may be some possibility of either expediting the second dose of AstraZeneca for people in our region, and or giving them the opportunity to, at a later time when we have more data from other studies about mixing and matching of the vaccine. So until that happen, we may offer an expedited second dose for AstraZeneca, and we've been in talks in figuring out some of the logistical details of that. So please stay tuned. Next week we'll probably be in a better position to share those details for people who are waiting for their second doses of AstraZeneca. We checked our database, so technically the first dose was given in Windsor-Essex approximately 8 weeks ago. So we'll be looking at that data, we'll be looking at some of the guidance, we'll be looking at the shortened interval, what it looks like for the AstraZeneca people if they want to get their second dose. As we know, the risk substantially goes down for the second dose for people if they haven't developed any adverse events after receiving the first dose. The risk for the same thrombotic event with the second dose goes significantly down to 1 in 1 million. So which is why we want to make sure that that option is available for everyone who choose to get their second dose and complete the series and get it done with, to offer them the second dose of AstraZeneca at an expedited schedule or something that makes sense for them, and also ensure the safety and effectiveness of the vaccine in place. So stay tuned for more details next week, and those are all my updates. Thank you.
We'll now take questions from the media. CTV.
Yes, good morning. I have a couple questions from my colleague Bob Belichico. He's wondering, has the health unit endorsed the Accessibility with Disabilities Act, which is an exemption for gyms to allow members with a doctor's note to exercise?
Well, I think it is under the regulation. So we again, we don't have much role in with respect to what is in the regulation. So the regulation allows that, and any facility who is offering services to these individuals, they have to follow certain guidelines, and they are aware of those guidelines, and they will continue to follow that.
So what is your reaction to hearing that a local gym has received a court summons, not a ticket, for violating the act?
I can't comment on it because obviously this is a matter between them. But as I said, under the regulation, if it is allowed under specific criteria. But as the businesses, they'll have to look at what their capacity is in terms of allowing or not allowing or opening it up. I can't really comment on that piece.
Okay, and one final one. I guess he's looking at a gym in Chatham-Kent is allowed to do it, whereas a gym in Windsor-Essex was doing something very similar and wasn't allowed. So he's wondering why the health unit has not embraced the act in the same way.
I'm not sure about the health unit's role. Our positions are generally the same. We support anyone who is following the regulations as it laid out and following the public health measures. We do support them. there are things that are not allowed in the regulations. So obviously, we do not support them. I can't talk about specific what is allowed and what's not allowed, but those are the active discussion and conversation. Our team is involved, not only our team, but all the enforcement partners across the region, our police and our bylaws. They are all involved in interpreting and enforcing some of these regulations.
Okay, thank you.
CBC?
Yes, good morning. Yesterday, Health Canada announced that it would be allowing Pfizer, or rather recipients of the Pfizer vaccine, to store the vaccine at temperatures between 2 and 8 degrees for up to a month. Does that have any effect on our local vaccine rollout? Is that helpful at all, I guess is my question?
So I can just speak to that. Yes, it is helpful because as we bring on pharmacies and primary care providers, the storage of the vaccine in their offices is critical. So the temperatures now in a fridge, most offices that are providing any publicly funded vaccine have the capacity to store it in their office, in their own facility in a fridge. So up to 30 days for Pfizer, Moderna is excellent. And those are the primary vaccines now with AstraZeneca as well. But it does help quite a bit. It helps with the transportation and the storage of the vaccine.
Thank you. Is there any update on when people, particularly seniors, will hear about their second vaccine appointment and how the health unit will be in touch on that? I spoke with someone yesterday who has family members who are awaiting word, and they book by phone and don't have internet access.
So we do plan on releasing more information. We know that the first doses will be starting for the 80+ population toward the end of June, and we are looking at all of that, and we'll give lots of information for people to book their appointment and to be able to call our call center. So all of that information is coming. It's just not finalized yet, but we will make sure that the 80+ population have the ability to get their second doses, and it's just figuring out all of the plans for that right now. We are finishing up with the healthcare workers' second doses and moving, as we're 18+, finishing up all those first doses the next couple weeks, and by mid-June we'll be into our second doses. So more information to come, and we'll get that as soon as we can.
Thank you.
Blackburn?
Just for clarification, the direction from that is that people in the state stuffed for a vaccine.
So Maureen, you were breaking up. Can you repeat your question again?
Just the point of the quarantining after getting a vaccine. If you go to the States, if they do that, they will be required to quarantine for 14 days. That's the new direction.
That's what I can see from what clarification was provided by PHAC is the intent of these travel is not for the vaccine, and so people, if they're traveling just for the purpose of vaccine, they may have to quarantine when they come back to Canada.
Okay. And in terms of the AstraZeneca, I know you're still figuring it out, but you are attempting to find a pathway that if people are willing to get the second dose of the AstraZeneca, that more shipments will be provided in Windsor-Essex?
Yes, that's what we are working on. We recognize that there's a large number of people who would want to get the second dose and get it done with and complete the series for them, rather than trying to mix and match the vaccine. And there may be some people who would want to switch to a different vaccine. So having the availability of vaccine makes it easier to give options. So we're hoping to give options to people in all the possible ways. And for those who are still waiting, we are working with the ministry right now to see if some of the vaccine can be given to them in an expedited manner, knowing that the demand for these vaccines are relatively low, because now we are not giving out the first doses. So we want to make sure that whatever doses we have, if there is any flexibility to give them an earlier schedule of these of AstraZeneca, we offer that while we're still waiting for the results from the mix and match study.
And if I recall correctly, there was around 30,000 people locally who got the AstraZeneca vaccine?
A little over 37,000.
Okay. And what was the original timeline for AstraZeneca? Was it around the 28th, like the 28 days, like the Pfizer, or what was the original timeline for AstraZeneca?
So as per product monograph, it ranges from 4 weeks to 12 weeks. And so the minimum interval is definitely 4 weeks. And what they found from the research is giving it at 12 weeks provides the best level of protection. And it's just the timing of the interval of the vaccine. And this is what UK has used, 12 weeks. And a majority of their population is vaccinated using AstraZeneca. And based on their studies, 12 weeks was found to be most effective. But obviously, we are not even at the 12 weeks mark yet. So we may, if this is what the ministry direction come down to, we may be offering this vaccine 8 weeks after, 10 weeks after, we don't know, but that's some of the potential expedited solution that may happen in Windsor-Essex, because we're the first one to roll out AstraZeneca in the province. So hoping that if there is that flexibility, we want to offer it to our residents.
Thank you.
Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Does Windsor-Essex have any or AstraZeneca on hand, or would you need to receive more shipments from the ministry?
No, we will be looking for more shipment from the ministry. Right now, we don't have any AstraZeneca at the health unit.
And are other public health units engaging in this conversation about AstraZeneca expediting those second doses, or is it just the WeChew because we were first to roll it out?
Well, with us, there were other health units. The only one that I can think of right now is Kingston, and but I believe there was one other. It may be the city of Toronto. So at this time, our conversation is along with Kingston, and because we were the first one to roll it out, so it just involves the three of us or the two of us at this time, and the rest of the health unit will probably learn the lessons from us and use that to apply in their own jurisdictions.
Are you looking to expedite those doses? You said something like just so people can get it over and done with, but is it so that they don't expire? Is that a factor?
Yes, because we definitely don't want to waste the vaccine, and as we know that we stopped the first doses, so so the ministry has some extra doses that can be used in an expedited way if people want that, and that's why there are still some details that we are waiting on in terms of the expedited interval. What would it look like based on the product monograph? As I indicated, it ranges between 4 weeks to 12 weeks, 4 weeks being the minimum interval. And based on the most recent scientific data, 12 weeks provide the best level of protection. But as I said, there may be some interest in the people to get an earlier expedited dose because they should technically still be under the product monograph, and there may be that opportunity. But we're still waiting for that confirmation from our province and the Chief Medical Officer of Health.
If you did receive the confirmation to go ahead with this, would it be in the pharmacies again?
Yes, it would be in the pharmacies, and we would expect that people will go to the pharmacy where they receive their first shot, and we'll be working with the pharmacies to make sure that they're giving it out to based on the criteria that we are identifying and ensuring that they're distributing it safely.
Okay, thank you.
AM 800?
I'm good, Taylor. Ask my questions.
CFTV?
Questions this time.
Any additional questions from CTV?
There's just one more. The provincial government's expected to announce at 3 p.m. today a reopening plan. Do you think a sector approach, as anticipated, is the right way to reopen as opposed to the regional?
I have no idea what the reopening plan looks like. I was not involved in any of the consultation process, so I can't even say what's coming down. We know there are like these public health measures, and they need to be lifted in a manner that is safe and that makes sense for each of the community that we're talking about. As we are coming closer and closer to the summer months, and we know the risk is higher in indoor environment versus the outdoor environment. So we'll have to think about how these restrictions can be lifted in an outdoor environment sooner than later. And with respect to the economy reopening part of it, I think that's the part that I we'll have to look at each of these type of industries that exist in the communities, and the overall picture of the community from an epidemiology perspective, from a disease transmission perspective, from a vaccine coverage rate perspective. So I don't know what the final plan would look like, but I would anticipate that it has to be gradual. It has to be focused more on lifting the restriction on less risky activity and going all the way down to the more risky activity for a later part of the restrictions.
Okay, thank you.
CBC?
No questions, thank you.
Blackburn?
No further questions, thank you.
Windsor Star?
No, thank you.
AM 800?
No, thanks.
And CFTV?
No, thank you.
Thank you, everyone.
Thank you.